Thank you, Jen. That helped loosen me up and increase my attentiveness. Mental health affects cardiovascular health and well-being on a scale that is disproportionate to the amount of attention it receives. Our next speaker, Bernadette Melnick, will help us raise the priority on diagnosing and treating stress and anxiety as part of our formula to improve hypertension control. Dr. Melnick is Dean of the Ohio State University College of Nursing, University Chief Wellness Officer, and she holds a host of other faculty and leadership roles at OSU. Among her many external leadership roles, she is Secretary-Treasurer of the National Forum. Reading Dr. Melnick's impressive biosketch is exhausting, but inspiring. I urge you to do so. Now, Dr. Melnick.
I am delighted to be with all of you today. I am going to make a strong case with evidence on why we need to be incorporating stress and anxiety to a greater extent in the prevention and management of high blood pressure and cardiovascular disease. I've got a philosophy in God we trust, but everybody else better bring data to the table. So I'm going to bring you quite a bit of evidence today. Before the COVID-19 pandemic, 1 in 5 adults were living with a mental health disorder. Now I say we've got a mental health pandemic inside of the COVID-19 pandemic. An MMWR report found that symptoms of anxiety disorders were 3 times those reported in 2019, and symptoms of depressive disorders were 4 times those reported in 2019. Higher rates of heart disease as a result of pre-existing mental health conditions are seen in veterans, women, couples with someone who has PTSD, and racial and ethnic underrepresented populations. The other thing we're seeing across the country right now, people are attempting to cope with the stress of the ongoing pandemic with unhealthy lifestyle behaviors. Drug, alcohol use is up, unhealthy eating is up, and physical activity is down. That is all going to have an adverse effect and contribute to more cardiovascular disease. So both long-term and short-term stress can play a role in the development, onset, and progression of heart disease. After an acute stressor, we know there's a cascade of changes in the cardiovascular, nervous, endocrine, and renal systems. Chronic sympathetic nerve stimulation of the cardiovascular system leads to persistent elevation in blood pressure, vascular hypertrophy, and plaque formation. This was a wonderful systematic review and meta-analysis. 11 studies were included with 5,600 participants. The authors found that psychosocial stress was associated with an increased risk of hypertension. We did a study at Ohio State. These people were screened as part of our Million Hearts Fellowship program. Compared to those individuals with low stress, controlling for a bunch of demographic variables, high stress was associated with significant higher risks of having pre-hypertension and hypertension. Another meta-analysis included 8 high-quality studies with over 950,000 patients. Anxiety disorders were associated in this study with a 24% increase in risk of strokes. We really need to screen for, identify, and offer brief evidence-based interventions to our patients, specifically for stress and anxiety. Many people underestimate the effect stress has on their bodies. This is a wonderful handout to talk about a 4-step approach about stress with our patients. Ask and listen, talk and screen. Offer suggestions, and I've modified that a little bit to offer brief evidence-based strategies to cope with stress, assess, and adjust. We really have to get into the habit of screening, asking our patients about stress and how they cope, and is it effective or could they use to improve? We need to screen diligently for stress, anxiety, and depression. However, there are still many providers across the country who do not routinely screen for stress, anxiety, and depression. We've got fabulous, brief, valid, and reliable tools to screen for stress. The perceived stress 4-item scale, for example, anxiety with the GAD2 and depression with the PHQ2. Screening does not equate to diagnosis, but it certainly raises a red flag that should be further evaluated. I always recommend the use of ESPER, screening, brief, evidence-based interventions, and referral as indicated to treatment. Well, there are quite a few brief, evidence-based interventions that we know through research help to reduce stress. For instance, deep abdominal breathing using The 4-7-8 method. Breathe in, count to 4, hold it for 5, breathe out for a count of 8. That cuts off the sympathetic nervous system, lowers blood pressure and heart rate. We need to tell our people that even 11 minutes of physical activity a day has heart health benefits. Another very brief, simple practice that has tremendous cardiovascular positive effects is a daily dose of vitamin G. For gratitude, if we could get up every morning, count just a few people or things we're grateful for, do that as we go to bed at night. That would cut stress and improve mood. Learning how to stay in the present moment, learning cognitive behavioral skills that I have taught with success for years in my COPE program, because the root of a lot of stress, anxiety, and depression is how we think. So we need to help people catch, check, and change their automatic, unhelpful thoughts. Lastly, we need to continue to assess and adjust as necessary, but partnering with our patients and providing ongoing support to help them learn to more effectively handle their stress and anxiety will go a long way to promoting cardiovascular health. So I'm going to put forward a few proposed solutions. We need to advocate for reimbursement for stress and anxiety screening and the provision of brief evidence-based interventions. Nurses could be doing this so effectively in primary care. We need to leverage community health workers. They can play such a key role in screening for stress, anxiety, and providing evidence-based interventions, especially in underrepresented populations. Lastly, we have got to emphasize SBIRT for stress, anxiety, and depression in health sciences educational programs, as well as prevention and early evidence-based interventions, including healthy lifestyle behavior change. So I'm going to finish by asking you to join us in our Mask On, Mood Up movement. Every time you put on your mask from now on, I'm going to ask you to take 3 deep abdominal deep breaths using the 4 or 5, 7, 8 method. Be kind to yourself. Say a positive self-affirmation statement 10 times. Research shows that does help to decrease stress. And lastly, take that dose of vitamin G every day. When you put on the mask, think of somebody you're grateful for. Turn around, call them, email or text them, and tell them why. Together, we truly can make a difference and improve the cardiovascular health of Americans. Thank you.